Hello, everyone. I am trying to go live here on a couple of platforms. I having a little technical difficulty, but nonetheless, I'm live. Hey, it's Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome to a Columbus Day Q&A. So I'm glad that you can join me. I hope that you jump on and ask all the questions that you have for plastic surgery. This is like a free consult. So, I mean, it doesn't get any easier than this. You just need to jump on. You just need to ask your questions. I'm here to field any questions or comments. So, this is your chance. I hope you enjoyed your Columbus Day. Uh, if you work in the government or you work for the school system or you just happen to have a cool boss that lets you off for Columbus Day, I hope you've enjoyed your day off and your extended weekend. I figured this would be a good time to jump on since I didn't really get to do my podcast on Saturday. A lot of things came up and just couldn't make that happen. I usually try to get those podcasts done a couple days before so that I can then just publish them, but just didn't come together this week. So I decided that it might be a good thing to jump on and do a Q&A. I haven't done that in a long time. I really hope that by now a lot of people know who I am. My videos have been out and they feel a little bit more comfortable jumping on, asking questions about anything that they have or anything that they need to know about plastic surgery. With that being said, let me tell you a little bit about myself. If you have not seen me before, I am a board certified plastic surgeon in Atlanta, Georgia. I've been here for almost 20 years. I can't believe that. Practicing in Atlanta, and currently I have a really nice boutique practice located in a bedroom community called Dunwoody, Georgia. Really enjoy this area. It's a great area, and we have a really nice office. So blessed to be focused and centered here. My journey has been a little bit unique. Just to go through that, I grew up in Virginia and I wanted to be a dentist growing up. And lo and behold, I did end up going to dental school and completing dental school. The reason I wanted to go to dental school because I had a lot of dental work. I got hit in the mouth with a baseball bat. I was a baseball player. I played a lot of baseball and traveling leagues and really played since I was knee high to a grasshopper, and got injured probably when I was in the 10th grade, and spent a lot of time in the dentist's office. And the guy that took care of me was great in Virginia Beach. I mean, he was really phenomenal. I stayed friends with him and still am friends with him. Uh, until this day. He had a wonderful practice and nice family and seemed to be happy. So went to the University of Oklahoma to pursue a degree in dentistry. And I actually did complete that. But on my way to completing that degree, I actually got interested in oral and maxillofacial surgery. This is a specialty of dentistry, which you can do a lot of things. You can take out wisdom teeth. You can take out kind of lumps and bumps of the oral cavity or mouth. You can take out, or actually not take out, but you can fix broken jaws. So I really got interested in that. I was fortunate enough to, you know, basically be selected for training at the University of Oklahoma Health Science Center at its heyday back in the early 90s, and trained 4 years in oral and maxillofacial surgery. And so I really got a good taste of hospital life, and I really enjoyed that. But it wasn't in my cards to become a plastic surgeon just yet. I spent a year in Tulsa, Oklahoma, and decided that, that wasn't really where I wanted to be. I thought about at that time going back to medical school because I had not gotten my medical degree. I was a dentist, uh, got my degree, and I was an oral surgeon, but I wasn't a medical doctor or a physician. So I decided to go back and get my medical degree in my hometown where I grew up. It just happened to line up. It was the perfect storm. I could go back to Eastern Virginia Medical School, and with some credit, because I had gone to dental school, I had done a residency for 4 years. I was able to complete medical school in 2 years instead of four. So I was able to accelerate that pace. And I really enjoyed that. And then at the end of medical school, I really wanted to see where I could go. Was I going to go into the realm of ear, nose, and throat? Was I going to do something totally different, different, which didn't make sense, or was I going to maybe become a plastic surgeon? And it just lines up or lined up to becoming a plastic surgeon just made more sense. Long and short of it, it was something that I could, bring in all my oral surgery training because there's a lot of facial stuff, and I could really stack that on top of plastic surgery. And so I decided to do that, and I was able to go back and do general surgery training at the Atlanta Medical Center, which is now defunct. God rest his soul. I had a fantastic time at Atlanta Medical Center. I got so much training. I met some wonderful, wonderful, wonderful people there, and it really molded me and really strengthened a lot of my surgical moxie. It just really helped. And so after that, I was fortunate enough again to train in a wonderful plastic surgery program, University of Tennessee, Chattanooga, Erlanger Medical Center. Uh, just had a great experience, just great, great, great people that happened to be my mentors. And I trained in all things plastic surgery. I trained in, of course, general plastic surgery, which means that, I was taking care of extremity or limb trauma. So if an orthopedic surgeon needed to have some skin placed over a broken leg that had, bones and plates and screws over it, then that's what we did. I did abdominal reconstruction where we rebuild people's bellies who've had, catastrophic injury or catastrophic medical illnesses like, you know, severe infection that wouldn't allow the general surgeon to close the tummy at the same time as they were treating the infection, and really leaned on us to kind of come in a delayed fashion to help bring things back together. We did burn surgery. We actually had our own burn unit. It was fantastic as well. It just gave me a lot of training there. We did breast reconstruction. My boss, if you want to use that, the big boss was a cranial facial surgeon, and so we did a lot of cleft lip, cleft palate, a lot of cranial, what we call abnormalities. We did a lot of that type of surgery. Cranial synostosis is the fancy $1 million word. We also had a lot of hand surgeons in our group practice there. It was really uh, a phenomenal training environment. And so I was well trained in plastic surgery. Of course, we got a tons of cosmetic experience as well, period. So that's a little bit about me. I really wanted to come on and hopefully feel some questions from you guys. I mean, I get on the internet from time to time or get on social media more specifically, and there are all these groups. There's this group for this procedure. There's a group for eyelid. There's a group for a tummy tuck. There's a group for facelift. There's a group for wounds or complications. There's a group for chin surgery. There's a group for this doctor and that doctor. And so that's great. Those groups support one another. I think they have value. Uh, but you have clients, patients educating one another. And I'm not saying that they can't because they have the unique personalized experience of going through the process so they can lend their experience, which is invaluable. But, at times you need experience from the practitioner because there still is a lot of misinformation in those chat groups. I just sit back and look and watch, and it gives me food for thought sometimes for my podcast. And if you guys aren't familiar with my podcast, I have a podcast every Saturday. It's called Plastic Surgery T&A. It's a little cheeky. That means talk and advice. It's on YouTube. It is usually published after 11 a.m. Eastern Standard Time on Saturday. So check that out. I'll leave you the link to one of the episodes so you can get a taste of it, and then you can check out the other ones if it's your flavor. But I really think that those groups are helpful, but they really again can spread misinformation. And so, with that thought, a lot of plastic surgeons on social media get on and do Q&As. And I thought I would get on and do a Q&A as well. So this is your time. I'm going to be here until about a little after 6. So if you want to hear me talk, which I don't really want to hear me talk because I get tired of hearing me talk, I want to talk to you. And so if you wouldn't mind, just jump on, leave a comment. You don't have to announce yourself. You don't have to identify yourself. Just ask the question because you have a burning question. I know because again, I look at social media and plastic surgery is everywhere, good, bad, and ugly. So jump on and let's talk about breast surgery. Let's talk about face surgery. Let's talk about eyelids. Let's talk about revision surgery. Let's talk about botched surgery. Let's talk about people who are famous you think had surgery. I'd be happy to give you my opinion. Uh, let's talk about liposuction. Let's just sit down and break the bread. So I really would like to do that. And for those of you who watch and hang on, there is a bonus at the end of this where I'm offering a new treatment in our practice, and I'll hold that until the end. And I'm going to give you some information about that new treatment and a limited offer. I mean, it's a big offer. You can get up to 50% off of this treatment if you follow the prompts and if you hang on and listen, and especially if you jump on and you participate. I mean, again, this is for you. This is not for me. I enjoy it. I'll do it. But it's after 5. It's almost 20 minutes to 6, and I could go home and chill and put my feet up and get ready for Monday night football and do all the things. But I rather answer your questions. So excellent. Excellent. I've got someone on. All right. So thanks for coming. Here's the question. So I'll read it and then I'll try to answer it. And of course, I'll try to do it best I can based on my experience. All right. So the question is, what is your thought on Botox for the forehead? Is there any risk of getting it done too early and then in causing any rebound wrinkling effect? So let's answer the first question. What is my thought on Botox of the forehead? I think it's fantastic. So I've done Botox for the forehead about 20 years, and it's FDA approved in 3 areas. The forehead is one of those areas. The other 2 areas would be the glabella, which is in the brow area between, and the crow's feet. At the forehead, we try to lessen the frontalis muscle again, which is the $1 million word, this big muscle that covers your forehead that makes the wrinkles just like my fingers. And so we try to soften that. And Botox works extremely effectively for that. Some clients that I've treated want a very soft result where they have some movement. Some people want a very staunch result. They want no movement. So it works really, really well for that. I usually start my clients off with about 25 units. That's how I do my Botox. I go on units, not so much by sections. Every plastic surgeon is different. And what I try to do is I try to figure out the right dose for your result. So 25 is a good starting point. And then depending on your result, whether you like it, then we can either ratchet it up or the next time we can bring it back down. So that answers that first question. Is there any risk of getting it done too early? And not in my opinion. Obviously, you don't want to get it done where there's no significant activity. But it's not any risk if you're starting to see some creases in your forehead that you don't like and you think by looking at your family members who maybe have never had this done that you're heading down some path that you don't like. And so coming in for a consultation with myself or another board certified plastic surgeon, but I prefer UCB, we would sit down and determine if this is the right time. But again, if you're starting to see these forehead wrinkles, it's usually pretty good time to consider that. If I had to stick to an average time that somebody would start Botox, it's probably in their late 20s for sure. There are a few outliers that may start in their early 20s, but the late 20s for sure. If you believe in pre-tox, which is a kind of a new thing or out there in social media, which is kind of preventative Botox, I don't know about that. I mean, it's kind of a little bit of marketing. Yes, you want to try to address these things early. Again, if you're looking at your family members, you're going, no, I don't want to look like that. I got to do what I need to do. So yes, you can have Botox earlier. You can see me. We can talk about that, and then we can work in a regimen if it makes sense for you at that time to start that, so that we won't have wrinkles that are super deep by waiting till you're 40, because the muscle's going to continue to activate and deepen wrinkles. But if you want to try to minimize that, it's really okay to start that earlier. So, is it preventative? No, it won't prevent wrinkles. It may soften them and delay the onset of them. So, you can kind of push father time, so to speak, out a little bit. So, that's the answer to that question. And let's see if I make sure I answered all three parts, because I think there are three parts. Not really seeing a rebound effect of wrinkling. Meaning that if I'm understanding the question correctly, I've not given someone Botox. They've let it, lapse, and then they have more wrinkling. If I understand that question, no, I've not really seen that at all. What tends to happen, and from an academic standpoint, if you're really consistent with your Botox, the Botox weakens the muscle response, so it makes it less vigorous. And if you're really consistent, that muscle gets weaker over time, and really should allow you to have less need for Botox, or less need for the dose that you started off with. So let me be clear. If you started off at 25 and we did this for the first year, 2, 3 years, really consistently every 4 months, you would see at maybe year 3, instead of needing 25, you may need 12, 12 and a half, 15. That's what Botox tends to do long term. Botox lasts about 4 months. Let's talk about that. It can last longer. Everybody's a little different. I've had patients that go 6 months, even upwards to 9 months, but I've also had patients occasionally that come under 4 months. That's rare, but it can happen. Usually lasts 4 months. I really recommend that you get it consistently. Again, that will keep the look that you want. It will minimize the long-term effect of that muscle deepening those areas, so you'll have a more refreshed, youthful look longer. There are really no downsides to Botox. There are no really allergies. If you have a pre-existing muscular disorder or neuromuscular disorder where you have weakness of your muscles in general, uh, whether that's you were born with that or you acquired that, then Botox may not be for you. But we wouldn't treat. That's not the type of client we would treat anyway. They're not the appropriate client. Um, can you, if you gave too much Botox, can you take it back? You can't really take back Botox. It's hard. And then one of the feared, I guess, results of Botox is there, I guess, two. One would be a really droopy eyelid. And you can have that happen. And it's happened to me once or twice. So you really can't take the Botox away. What you can do is a couple things. You can give the client a couple of eye drops, which will help raise the eyelid muscle and kind of help keep it stimulated up until the Botox kind of wings over the next couple of months. That's one thing you do. The other feared complication, or unusual result, I'm not going to use complication, is having a brow that's way too up. That's really easily remedied. You just kind of give a little extra Botox to kind of dampen that down and even out the brows. And speaking of my brows are looking rough. But that's what you can have it with Botox as far as an unusual outcome. Some people use Botox in non-FDA approved areas, and as a practitioner, a mature practitioner, I do that as well. So as I mentioned before, if you just joining me, we're talking about Botox. Uh, we had a we had I'm just gonna say we had Stephanie jump on. She asked a great question. So we're leaning into Stephanie's question long term until somebody else jumps on and asks what they really want to know. As I mentioned, Botox is FDA approved for the forehead, glabella, which is the fancy word between the eyebrows, and the crow's feet. You get these character lines. Typical, usual treatments. It has been, and I won't say can be, anything can be done. It can be given in the bunny line. I need some in my bunny line, as you see right there. It can be given in the neck for neck bands. It can be given in the corners of the mouth to kind of help lift and elevate the mouth. It can be given somewhere in the upper lip, we could call a lip flip. It can be given in the jaw for muscles that are really big that give people kind of a wider face. Can help reduce that muscle to narrow the face. It can even be used in the armpit. It can be used in the armpit for people with profuse sweating that have failed all types of medical therapy. So those are just some of the indications for Botox. Botox can be used kind of more in a medical sense for people who have cerebral palsy, or maybe a spastic disease, where we can inject Botox in that really tight arm or leg to reduce that clenching of that, let's say, the elbow at the armpit, or and so that that area can be cleaned. So Botox has obviously cosmetic indications, but it also has some really wide ranging and broad medical uh, indication as well. But I use it strictly because I do or perform aesthetic procedures and aesthetic surgery. We use it strictly for aesthetic surgery here. It's really nice for kind of raising the upper lip. There's some surgical procedures, minor ones, that can help with that as well. But as a non-surgical option, you can try it here just gently to kind of help raise that lip. If you overdo it, then you've got a lip droop, and now you've got a problem. You've got a problem because you can't reverse it. It's not really anything I think that you can do anywhere else to counteract that. So now you've got a patient who's got a lip droop, who may have a change in their speech, who can't hold their fluids or their meals. So you really, really have to be cautious. In the neck, it's really good for neck bands. People who are not really ready or not desiring any type of surgical neck operation, whether it's a lift or combined with a facelift, but they want to try to soften these bands. You can treat these bands, these up and down bands, with a little Botox. Again, you have to be really, really careful. Some small dose. You have to pick up the muscle. You can't let this go deep, because there are a lot of structures here that are critical, such as the nerve and the muscles that help open your windpipe and keep it open and help you breathe. You can't mess that up. You cannot have a problem there. So, which leads me to this statement. Every Tom, Dick, and Harry is injecting Botox. That's whatever. As a younger plastic surgeon, I used to get out here and beat the streets and go, oh, only this person can do this and only that person can do this. Hey, I'm too old for that. I know the training I have that allows me to do the things that I do safely, because I can take care of the complications. So my point to you is, if you go to someone and you like them and you're comfortable with them, then go to them. But you better make sure that they can take care of the complication if that occurs. And complications occur if you do enough of anything. So if you're going to I'll just say non-plastic surgeon, that could be anywhere from a injector to a medical doctor who is not a plastic surgeon. It's great when everything goes well. Just make sure it's going to be okay when everything doesn't go well. That's all I'm going to say on that. So it's up to you. So that was exhausting, or exhaustive, because I'm exhausted. That was exhaustive talk on Botox. So, Stephanie, I really appreciate you coming on and asking that question. That's a really kind of a good question. And everybody wants, or is at least considered, Botox. And it's a really good entry point into plastic surgery. If you want to do some things to help, maintain your look, or even improve your look, it's not too intrusive. It's not much downtime at all. So it's a really good way to start. So with that being said, any other questions? Again, this is a Q&A. I'm really here for you. I don't want to hear myself talk because I'm tired of talking. I'm gonna take a drink of water because I really want to just answer questions. I don't want to talk. So along that line to the next question, if we get one, I'm here. But until that time, let's talk about some interesting things that happened to me in the last couple of weeks that I will talk about in depth. If you listen to my podcast, again, my podcast every Saturday morning, 11 a.m. Eastern Standard Time is usually published. It's called Plastic Surgery TNA. That's Talking Advice. It's on YouTube. And so a couple of topics that have come to my attention by clients that I've interacted with. Two that are just top of mind. One is from one of my old high school classmates. I didn't even know she watched me on my various social media channels. I remember sitting behind her in homeroom. Just a great, I enjoyed being her friend. I hope she calls me a friend. But she reached out and said, "Hey, for those of us who just don't want to go into the knife, since you're a surgeon, I know you talk about surgery. What about some non-surgical things? So what about micro needling and doing that at home?" So at some point here, really soon, I'm going to talk about some home remedies. Everybody's on Amazon at least, and I don't know all the sites. And I'm gonna be really sexist here, and I don't mean to. I'm a guy, so I do some stuff and for my face, but I'm not like my wife. My wife is on every type of beauty product page, and she's telling me all this. And we actually have banter about this. I may just bring her on because she's the expert at this kind of home remedy, non-surgical stuff. And let's talk about that. Let's talk about what's fact, what's fiction, what works, when it works, what's best, so on and so forth. So, my old high school homeroom classmate brought this to my attention, so I thought it was a great topic. So I'm going to talk about that. And then I had an interesting interaction with a potential client that reached out to me, and she was interested to know about breast implant illness. Again, it was a lot of stuff about breast implant illness several years ago, and it's still a topic that is somewhat top of mind. But I think like anything else, it's waned. So we're going to talk about breast implant illness, what it is, what it looks like, uh, how it's treated, and just maybe dispel some myths, maybe confirm some facts about it. So again, that's I think another interesting topic to revisit in my podcast. So we're going to talk about those two things, and then because it is Breast Cancer Awareness Month, hence the pink glasses. So I'll just go ahead and rock those. Um, we're going to touch on some things about breast cancer reconstruction. I had another client reach out to me out of state and wants to talk about breast reconstruction and what are the options. And there's so much information out there. You know, there are many ways to create. Uh, I want to say create confidence, create security, improve psychological functioning by breast reconstruction. You can do that with implants and tissue expanders, which take a couple of steps. You can do that with your own tissue, and there are several ways to do that. Uh, whether that's an easier way or a more technically advanced way using microscopes and so on and so forth. But I will touch on that here and there. And if anyone is out there listening and they've suffered with breast cancer personally, or they know a loved one or a friend who suffered with that, and you have a question, again, I encourage you to jump on and ask me that question. And if you just don't feel like you have the time to ask the question now, then leave a comment in the comment section, and I'll try to answer that question. Or, at the end of this, I'll give you an email. You can always email me, and we can have a brief discussion. We can even set up a brief, what I call contour conversation, where I jump on the phone for 15 minutes with certain clients, potential clients, and we can have a conversation, video conversation about your concerns and see if I can address your concerns and if I'm the right fit for you. So we definitely can we can do that for sure. So those are a couple things that I want to talk about. Uh, I may talk about, certain trends. I've done that in the past, about, things like trap talks where Botox is injected. We'll get back to the Botox thing, injected into the neck muscles to kind of weaken them and soften them to give a more feminine contour. We could talk about that. Uh, I talked about cellulite recently. It's not a fad or a trend, but there have been many, many, many treatments for cellulite. And I've got a really nice treatment that was brought to me that we're going to introduce into our practice. It's called Avéli, and this is probably a good time to bring that up. So we're going to introduce Avéli to our practice, uh, hopefully soon, as soon as you guys want to do it. Basically, I've got a promotion out, and all you have to do is, and I would have you stop. If you're doing anything now, if you don't have a question, if you don't want to really participate, I don't feel like you can at this point, but you have cellulite, and every woman, a lot of women have cellulite. Up to 90% of women have cellulite. We're having an introductory sale on Avéli, which is a new FDA approved approach to reduce cellulite. And what you need to do is participate in our flash sale. Copy this link. Go to this link, fill out our form. My office will call you, will give you the details of our 50% off Avéli Cellulite Reduction special. It's only for 1 week. The special will only be for a week. So if you want to really capitalize on this, you don't like the look of your thighs, you don't like the look of your backside because you've got some cellulite dimples, this may be a good opportunity for you. So copy that link, follow the instructions. My office will reach out. We'll set up a consultation to see if you're a good candidate for this, and we can get this done for you for half the cost. And it can be done in our office. It's minimal downtime, done under local anesthesia and a little mild sedation to relax you. And let's see if we can smooth things out for you. So again, if you're really interested in that, I implore you, I'm begging you, excuse me, to copy this link because it's only for 1 week. After 1 week, the price is going to go back to full price. So you get a chance to be in on our introduction of Avéli to our practice. So copy this link, and I look forward to consulting with you about smoothing out your cellulite. On that note, it's been about 30 minutes. If anyone else has any questions or concerns, this is the time to jump on, ask your questions. I'm here live to, answer what you have to know or need to know. So please jump on, and we'll chop it up. If not, then it may be a good time to kind of wrap things up. I'm going to leave you with a couple of things that I want you to also kind of consider or even write down. Hopefully, you've written down that flash sale that we're having this week. Go to that. Remember that we have the podcast every Saturday. So make sure that you are tuning into that at your convenience. So it's posted every Saturday, so you can watch it at your convenience. If you want to watch a podcast episode, and you're considering cellulite treatment, this might be the episode for you. So copy this link, and this will take you right to my podcast playlist. And this episode is about Avéli and how it works, how we do it, so that you'll be familiar with it, so that you can, when you come in, you'll have a lot of background and you'll be ready to run. So copy that link for Avéli. If you have general questions about anything that we do here at ESJ Aesthetics, I encourage you to do a couple things. I encourage you to reach out by emailing me at concierge@esjaesthetics.com. Uh, My staff will answer questions. If they can't answer, they'll direct it to me, and I will answer your question. So, if you have any questions, concerns, or you want to schedule your personal consultation, please do so. Use this email to do that. So, I would encourage you to do that as well. If you know that you want to book a consultation and you just want a more direct way, I encourage you to call my office at 770-466-4700. We are open 5 days a week, Monday through Friday, from 9 a.m. to 5 p.m. Eastern Standard Time. As I mentioned early on, I'm located in lovely Dunwoody, Georgia. Our address is 1730 Mount Vernon Road, Suite A, Dunwoody. And here's our number. If you would like a consultation, I am an expert in aesthetic surgery. I love aesthetic surgery, and I focus on a couple of things for sure. I focus on upper and lower eyelid surgery. I focus on facelift because of my background in oral and maxillofacial surgery gives me some unique training versus others. I focus on chin surgery, and I usually use your own chin bone to kind of help it enhance your chin and neckline. We can use an implant, but I use your own body to your advantage. So definitely do that. I've done a lot of breast work, breast augmentation and lift, breast reduction. You certainly can visit my website and see some of my before and afters at www.esjaesthetics.com. So we definitely do that. One of my favorite operations is a tummy tuck with liposuction. It's just nothing like, giving a woman a shapely waist. It's just nothing like it for me. I really enjoy that surgery, and I've done and do a lot of those as well. I do some what I call thoughtful fat grafting to the hips and buttocks for shape and complementary shape. I don't pack a woman's booty or a man's booty for that matter to give them this big cartoonish butt. We contour waist, we subtly add and thoughtfully add fat to areas that would need enhancement to give you the best silhouette possible. So again, those are things we do. We do some local things in the office as well. We do some local areas of liposuction in the office with a little sedation and local anesthetic, kind of lower tummy, little bulge there, maybe a couple little bulges at the love handles we can do. We also do outer thigh as well and chin. We can do that in the office for you. We do upper eyelid lift in the office or upper eyelid blepharoplasty as well. Additionally, kind of more traditional things, Botox, like we talked about, Juvederm fillers, scar revisions, but it's all on our website. And I encourage you to spend some time on the website. The website is under a kind of constant change. Check out our blogs, check out our before and afters. We have tons of FAQs on each procedure. There's more stuff coming, such as video. So really kind of stay tuned for up to date information from our on our website about the things that are happening in my practice, and that's ESJ Aesthetics. And with that being said, I hope that you guys have enjoyed this, maybe listening to me. If you do have questions and I just didn't have time to get to it, hopefully you can either email them, call, or even make comments in this post or this live stream. And like I said, I will definitely try to get back to you with an answer. But until next time, uh, I will see you soon. Check out my podcast this Saturday. We've got some great things coming. Have a good evening. Peace.